Evening, everyone, and welcome to this evening's Hot Topic CME session. My name is Steve Kushner. I'm a family physician and past president of the Medical Society of Delaware. We are delighted to have you join us for what promises to be an informative and timely program. Tonight, we'll focus on emerging high-risk infectious diseases in Delaware, a focus on measles, Ebola, hantavirus, and public health preparedness. This session is approved for an AMA PRA Category 1 credit. Following tonight's session, an email will be sent with instructions on how to claim your credit, so please be sure that your name is displayed correctly on Zoom. Our speaker, Dr. Ayanna Buckner, serves as the Chief Physician of the Delaware Division of Public Health's Office of Epidemiology, which conducts disease surveillance, outbreak investigation, and health data analysis for the state. Dr. Buckner previously served as the director of the Regional Coordinating Center for Hurricane Response at the Morehouse School of Medicine, through which he managed multi-state projects to assist with rebuilding health systems in the Gulf region after Hurricanes Katrina and Rita. Dr. Buckner received a Bachelor of Science degree from Xavier University of Louisiana and a Doctor of Medicine degree from Meharry Medical College. She completed a combined residency program in internal medicine and general preventative medicine public health at Griffith Hospital, during which she received a master's degree in public health from Yale University. Dr. Buckner is board certified in preventative medicine, public health, and internal medicine. She is a fellow of the American College of Preventive Medicine and was a Marshall Memorial Fellow. We are delighted to welcome Dr. Buckner.
Thank you so much. I know there's bad weather out there and there's so many things going on in our world. So it really does mean a lot to us at DPH that you joined us. I hope I didn't make any of you nervous. I just realized that my camera was covered, but I've been sitting here. So Lynn, I'm very sorry about that. But at least I figured it out. Okay.
No worries.
Thank you. Because of the existing measles outbreak, which was announced by DPH on July 22nd, we're going to start off with measles. So this presentation is designed to make you hopefully more comfortable with the recommendations that we're making, and also help you to understand how to interact with us at DPH, who to call, what to expect, etc. I'd initially planned, and we'll still get to a little bit about hantavirus and Ebola and New World screwworm, but I've taken some of my slides out that I planned to initially do and may still skip over some because I want, just kind of depending on how things go, because I want to make sure that we have, that we save time for you for discussion. I'm also joined by a very important person, probably one of the most important people in my professional life right now. So you'll hear from her at the end, and that's Kelly Callahan, who's the section chief of DPH's Office of Communications. And she's going to help walk you through some important resources. So hopefully you're able to stay on and hear all of that. So let's start off with responding to a measles patient who is under investigation, or what we at DPH call a PUI. So how do we respond? So you'll see that I've got listed here our Office of Infectious Disease Epidemiology, or what we've referred to as OIDE. Within our Office of Epidemiology, we also have our Office of Environmental Health and Informatics, and our Office of Family Health and Safety. But for the purposes of this presentation, we're going to talk about what you would expect when you work with OIDE, or Office of Infectious Disease Epidemiology. So we're going to want to know the patient's clinical history. We are also the folks who approve measles testing at DPHL. If you choose to use a commercial lab for measles testing, that's okay. But our team approves measles testing at the Delaware Public Health Laboratory, or DPHL. And we also interview the case patient and their family to identify close contacts, exposure points, and we also recommend isolation or quarantine, depending on what's going on, when it's appropriate. So please expect us to ask about that. We'll ask about if you know about any contact exposure points because that helps us to identify who's exposed so we can contact all exposed people to assess their immunity and recommend post-exposure prophylaxis or PEP and or quarantine. Quarantine is when there's been an actual confirmed diagnosis. Isolation is when it may be suspected, but we're not sure yet. We also work with our DPH Office of Communications to issue media releases if needed, which is why I mentioned Kelly Callahan before I even got to introducing her. What do you need to do if you have a measles patient who's under investigation in your facility? First of all, please be thinking about how to minimize exposure in the waiting rooms and other public areas. This is something that you should think about ahead of time so when the time comes, you're ready to act. Isolate the patient using airborne and standard precautions. If you've got an airborne infection isolation room, please use that. If it's unavailable, put them in a single patient room, close the door, and call our office immediately. Our number's 744-4990. And as I mentioned previously, we can provide testing approval and also help guide you through the process. You will usually speak with one of our epidemiologists, but you've also got access to me, who, as I mentioned, I'm the chief physician and I run, well, as you heard, I'm the chief physician who runs the Office of Epi. So you've got a board certified internal medicine and preventive medicine physician at your access to help guide you through the process. Also, if you can also please ahead of time ensure that all treating healthcare personnel have documented immunity and limit and track the healthcare personnel who treat the patient. Also can you expect from us? We're going to ask you, as I mentioned, about the patient's history. We're going to ask about signs and symptoms, including the dates of onset for each individual symptom. Those are things you would usually collect in your when you're seeing the patient anyway, but we'll ask you about that. We want to know where they got exposed. And also, this is super important, known exposure to a confirmed or suspected case, travel, being a part of or connected to a community known to be vaccine hesitant. Those things are super important for us so that we know how to be prepared to act. We also want to know where they've been when they're contagious, such as public places like schools and places of worship, and household and other close contacts. We're going to ask about their vaccination history. Oftentimes, we have access to that in Delvax, but sometimes that's not available because someone's from out of state. It would be really helpful if you can ask about that. And ideally, if there's documentation from your medical record if you have any copies that patients have provided to you, if you could share that with us if it's not in Delvax, that's also super helpful. As I mentioned, approval from our team is required for testing at the Delaware Public Health Lab. Even after hours, we've got one of our epidemiologists who's on call who can provide approval for that and also give you recommendations about how to get that sample to us. The Delaware Public Health Lab provides specimen transport based on a predetermined schedule. And you'll see this is intentionally written this way, or a notification / approval for special pickup, because we can do that, but that's available on a limited basis. Because there's a predetermined schedule and because getting that kind of off track can be problematic, there is special approval required for a special pickup. And results are usually available between 24 and 72 hours from receipt. Also, obviously, that's depending on how busy our lab might be. Again, please be sure to isolate the patient during specimen collection and make sure that the staff in your office have documented immunity, but also use PPE. And that's super important. And as I mentioned, in addition to isolating the patient in a room, we encourage patients if they know that they're having measles symptoms, we encourage them to call ahead. And so if they call your office, please have your staff prepared to tell them to give the patient instructions for how they should enter. Before we send anyone to a hospital for immunoglobulin for post-exposure prophylaxis, we call ahead and coordinate and give the patient specific instructions about how to enter. Sometimes it's using a non-public entrance, but other times the hospitals have a different system worked out. We encourage you to think about that, whether you're working in a hospital or in an office or elsewhere in a health system. We usually coordinate with the infection preventionists at the hospital. If there's one who's available, usually they are during the daytimes, usually on call too, but that also depends. And then also please keep in mind that patient rooms should not be used. A room where a patient with suspected measles has been, that room should not be used for at least 2 hours after the patient has left. What should you be thinking about while you're waiting for the results? First of all, please identify when and how the patient arrived and where they were located and treated. How did they enter and exit? Um, did they visit any public areas? Again, touching on things I've mentioned before, but you'll see there's some nuance to that. Again, as I just mentioned, keep in mind that measles can linger in the air for up to 2 hours. And then please have the name and information, contact information available for patients as well as staff. Sometimes, depending on the health facility size, a health facility may manage contact tracing, or I should say monitoring, well, contact tracing as well as monitoring of their staff. But that's not always the case. Our team is available to do that. That's usually a conversation that we have with the folks, with the leadership at the facility to determine that. And then we contact all exposed people, or you might, if they're your staff, to assess their immune status and determine if post-exposure prophylaxis is recommended. While you're waiting, you can begin to review the post-exposure prophylaxis recommendations. And if your facility is going to offer MMR vaccines or immunoglobulin, start thinking through where and how patients will get it. Will you offer it just to adults? Will you offer it to children? Will you offer it to both? Again, these are important things to be thinking about ahead of time, and maybe there's a team of folks at your facility that you have to work through to answer those questions, or maybe it's a smaller team, but still important to be thinking about those ahead of time. Also, determine, as I mentioned, who will conduct the assessments. Is it something that your staff has the capacity and knowledge to know how to do? Or if let us know if you'd like us to do it. As I mentioned, frequently facilities manage it through their employee health, but frequently DPR, DPH EPIs can do it. Some facilities also offer to contact exposed patients and schedule them directly for PEP, but since I've been at DPH, our team has done that. Be thinking about a media release. If your facility cannot discreetly identify everyone who is potentially exposed, a media release may be needed. They're not always used, but they sometimes are. So be thinking about that. And obviously, there are other factors that might be considered on a case-by-case basis to determine if a media release is necessary. So that wraps up our discussion, or what I wanted to walk through about measles. I'll make sure you have the information toward the end of this presentation. There's a slide with our office's contact number, so don't worry, you'll have that. And also, as I mentioned, Kelly will share some resources, and those resources also have a way to reach us. Very briefly, because Hantavirus was so important, and because there's important connection to Delaware, I do want to ask if you knew that the first U.S. Andes virus was in Delaware in 2018. There's a very nice report in CDC's MMWR, or Morbidity and Mortality Weekly report, about that. I won't read anything to you from that, but did like, because I enjoy trivia, I thought this would be a good thing to ask and to share with you. To date, there have been no cases of Andes virus confirmed in the U.S. as a result of this outbreak, and the monitoring period has ended for everyone involved. Ebola. I'm not going to go through stats about this, but I do want to say that Ebola is still a very serious outbreak, but the risk in the U.S. is low. Priorities are being focused on the Democratic Republic of Congo, Uganda, and neighboring nations. CDC has a 24/7 clinical consultation team available for potential exposures and for people reporting symptoms. But what you would need to do is to contact us if you think that you've got someone who's exposed, and we have a process within DPH to involve our emergency preparedness staff who would reach out along with our epidemiology team to coordinate and also to reach out to CDC to discuss testing, arrange meetings, arrange potential transport to specialized centers, etc. New World Screwworm. I just want to give you a little bit of a warning if you don't like seeing gross bugs. You might want to close your eyes or take a little break now. Oops, I'm sorry, I didn't mean to jump ahead so far. Okay, so what is New World Screwworm? It is a parasitic fly. The adult fly lays its eggs on open wounds, and the eggs grow into parasitic maggots. So, who are the people who are at highest risk? Those are folks who spend time outside in endemic areas, especially when sleeping. And the screwworm can infest any warm-blooded animal. Here in the US, so far, there have been no human cases, but the cases have involved livestock and birds, and it can be devastating for livestock. New World screwworm is endemic to Central or South America, as well as the Caribbean and Mexico. Here's a picture of the screwworm. I do want you to take a good look at this. And also, if you think that you have a patient who's possibly been infected, you want to certainly find some photographs and or graphics to help you identify the worm. You'll see that the larva is tapered at both ends. It's pale with dark spine bands, and it's dark near its trachea. And you'll see, yeah, there it goes. Here, that's the dark end near the trachea, right where the arrow's moving over. You likely won't see the flies, but there's a description there if you're interested. As I mentioned, there are no human cases in the U.S. in the U.S. at this time, but the flies are primarily infecting livestock in the U.S. and South Texas. At this time, still risk to the general public is still considered to be low, but it's something that we are certainly keeping an eye out for. At DPH, we're still very much active in the calls that CDC has around both Ebola and New World screwworm to make sure that we stay abreast of any new developments and become aware if there are cases that are happening near us. So what would you do if you suspect that your patient has it? There's a reason I spent some time walking through what the worm looks like, because we need you to be able to identify the larva. If maggots or larvae are removed or come out of a wound, please don't throw them in the trash. That could make for a very terrible public health situation. So please ensure that no maggots or larvae enter the trash or the environment, because we don't want it to spread here in Delaware. Our number is here. Our email address is here. As I mentioned, it'll also be on the slide toward the end of the presentation, but we would certainly want you to call us in the event that you're suspecting this, so we can help walk you through it and guide you through the process. So we would want you to place any larvae or eggs in a leak-proof container, submerge in alcohol, and then put it in the trash or medical waste. But at this point, we'll be talking to you and guiding you through it. We don't want you just to put it in there before you call us. And we don't want any live eggs or maggots in the trash or outside. As I mentioned, that could absolutely be disastrous. I mentioned already that we're a part of CDC briefings. These briefings are usually in support. They're either actually directly through through CDC, or they are in collaboration with the Association of State and Territorial Health Officials and the Council of State and Territorial Epidemiologists. One way that CDC communicates with us is through a system called EpiX. And that's a secure web-based platform that allows for instant transfer of public health data to jurisdictions across the US. It's also how jurisdictions communicate with each other. For example, if there's an exposure in Delaware that involves a resident from a different state, we send information to the state via this exchange. We also are very collegial with our colleagues in neighboring states, so we frequently email and call them to give them a heads up that there's going to be an EpiX communication because that allows us to just make sure we can answer any questions that they have. And I like to mention this so that you know that we are using some of the same tools that other jurisdictions are using because we want you to know that we are communicating with each other. That is the best way that we can help to make our region as safe and secure as possible. So our response plans for hantavirus, Ebola, New World Screwworm, and measles all build on our collective experience from the COVID-19 pandemic. We learned a lot through contact tracing and active monitoring during that, and certainly early engagement with our partners, which, as I mentioned, EpiX is one way that we do that, in addition to the CDC and ASTO and CSTE meetings that I mentioned previously. So DPH has a high consequence infectious disease plan that lists trigger points and ensuing actions. It talks about intra and interagency coordination. And we have something called SHOC activation or State Health Operations Center activations that allows us to put this plan in place and bring DPH and HHS partners together once individuals, or even sometimes one individual in Delaware, is identified as exposed, and allows us to have focused coordination and response and diverts our DPH staffing resources so that we have adequate resources for our response plan. Our here in our Office of Infectious Disease, EPI, we are doing twice daily monitoring of exposed persons for Ebola. We've got a couple different ways that we do it, but mainly it's through phone monitoring. We do symptom screening, temperature checks, wellness checks, and the folks who take the lead on that is that it's our Office of Infectious Disease Epidemiology team. If there's a need to, we can expand outside of that team and pull in our epidemiologists from the other two offices that I mentioned previously, our environmental health and informatics team and our family health and safety team. All of our EPIs are being trained to help in the event of a large outbreak or a pandemic. They would, all of our EPI team would be available if needed during a large outbreak or response. And then we also have the ability to engage DPH nurses if needed. Again, if an exposed person develops symptoms, particularly for one of these high consequence infections like New World Screwworm, Ebola, or when we were in the Andes virus or hantavirus period, we would have very careful coordination between our epidemiology team, our preparedness team, the receiving hospitals, and transport companies. Delaware is in HHS Region 3, which also includes Maryland, Pennsylvania, Virginia, West Virginia, and Washington, D.C. And we have a specialized regional emerging special pathogen treatment centers or respect centers. We have two of them to safely help us treat high consequence infectious diseases. Both Johns Hopkins Medicine and MedStar Health serve as level one respect centers in this network. And as I mentioned previously, if a case is identified, we'll coordinate with CDC and our emergency preparedness team for guidance about whether someone could be safely treated here in Delaware or whether they had to go directly to one of the respect centers. So just a couple highlights. What are we doing? Internal coordination. across our DPH leadership and Office of the Medical Director, my office, our Emergency Medical Services and Preparedness section, as well as the Office of Communications. We are also working with our colleagues in the Department of Corrections and the Division of Healthcare Quality, as well as other divisions, because we know that if something major happens, it might not even happen out in the community. It could happen in a Department of Corrections facility or in a nursing home. So we want to make sure that we stay on top of communication with our colleagues and provide them with the resources that they need. We also coordinate with other states, local stakeholders, and CDC, as I mentioned. So with that, I'm going to shift it over to my colleague, Kelly Callahan, who I mentioned is the section chief of DPH's Office of Communications. Kelly is one of my favorite people. I don't know if I've told her that, but she both keeps me in line and bails me out. So I fully trust her to share with you how you can sign up for the Delaware Health Alert Network. Um, and she will also share our contact information for our office. The time that I've spent already was about you preparing, reviewing your plans, and informing your staff and stakeholders. So actually, here's my contact information, but we'll stop here during our Q&A period so that you will have this information. But for now, I'm going to just advance the slides and move forward to Kelly.
Great. Thank you, Dr. Buckner. And I am so lucky to work with someone like Dr. Buckner who has such incredible knowledge on all of this. And as a communications director, one of the things we always worry about is making sure that our communications are health literate for the general public, and couldn't ask for a better partner than Dr. Buckner to help break that down and be able to communicate that message to the general public so that everybody understands it and understands what they need to do, in addition to communications with physicians and other healthcare personnel.
Thank you.
So we would recommend that everybody on here, if you are not already a member of our Health Alert Network communications group, please use your professional email for registration. You can use this QR code, or when the slides are out, you can also click on the link that will go directly there. One thing I will caution is that right away when you get your first HAN, it typically does go to promotions, spam, or junk folder. So just check for that right away. If you hear an issue that might be happening in the community, you can expect that Dr. Buckner has written a HAN to coordinate with it. So make sure you check that. But we ask everyone to use their professional email for registration. This is really restricted to medical personnel and professionals, and we like to ensure that we have accurate data, accurate information of people who are getting these health alerts, and that's why it's important to use your professional email if you can. Okay, so moving on to other communications methods that we have here and things that are available. Right now, our primary point is to direct everyone with regards to the measles outbreak to our specialized public health alert page on measles. That is de.gov/measles. So real easy, short URL to remember, de.gov/measles. On that page now, you can find basic information about measles. That's for the general public. Our current case count, we will be keeping our current case count on there and not necessarily issuing a press release for every new positive case. Our HANs are on there, our Health Alert Network notices are on there currently for measles as well. Our press releases since the start of the event, so since July 20th, we do have 3 press releases that are on there confirming what we've put out there in easy format for everybody to follow along so that nothing is missed. And we have a link to our call center, which opened today. That is a call center for the general public. If the frequently asked questions document, basic info, and other things that we have on de.gov/measles still leaves them with some questions, we have the call center available. That's the toll-free number. The call center is available 8:30 to 4, Monday to Friday. That information, again, is on de.gov/measles. Again, it is 8:30 to 4, Monday to Friday. You will reach one of our call center operators who has full scripts that the doctors like Dr. Buckner have gone through and provided succinct answers for. But if somebody still needs more information, we'll take their number and get back to them with those details. We suggest that everybody please follow DPH on social media, not just during the measles outbreak, but all the time. We've really worked hard to revamp our social media pages over the past year. We're on Facebook, Instagram, and we debuted a new YouTube channel last year, the end of last year. That is at DE Public Health. We have launched a couple podcast episodes, and we are working on doing more, hopefully following the outbreak. But on there right now, you can see videos and news updates. There are updates on the measles and any information that we put out. It's also on there in video format to make it easier for anybody and fully accessible. Additionally, the DHSS webpage, of which DPH is a part, has recently undergone a transition, and there are items still being updated on the general DHSS web pages. So what we've done in the interim is on our DE Public Health YouTube channel, we've taken all of our frequently asked questions, documents, and there are hundreds of them, about various illnesses, things that are out there. We've put them in video form. So they're a quick 3 to 5 minute video that anyone can click on and get information on that. That's a valuable resource for all of you as well. So encourage everyone to subscribe to our YouTube page and join and like our Facebook and Instagram pages to stay up to date. That's where we're putting out all of the most updated measles information right now, but also lots of other good material, things that you can use in your practices and stuff as well, talking about screenings and other things that are out there. So really encourage you to follow DPH on social media. Again, just look for DE Public Health on any of those services. And this is an example of some of the things available on our YouTube channel. We currently have a lot of stuff about measles on there, but we also have a lot of stories about the heat, tips and tricks for people that have to work outside during the heat, things of that sort, celebration of our trauma unit, which the Delaware State Trauma Response just celebrated 30 years. We had a great, at the Trauma System of Care, great partnership with hospitals and other facilities throughout the state for that. It was a great celebration, talking about literally thousands of lives saved as a result of that network. And we have a tribute on there as well for that. So lots of good stuff. Please don't hesitate to subscribe and check it out. And these are our FAQs. If you go to the playlists on DE Public Health YouTube, click on where it says playlist, and you will see all of the FAQs in alphabetical order for a whole variety of things, all different illnesses, all different things, and we're updating them as we go along. That is one of the new things that we will be doing for the updated DHSS website and making everything fully accessible. By law, everything has to be fully accessible on all health websites by next May, but the state of Delaware has taken the approach that all items that we put on will be accessible effective immediately. And so we are updating everything to ensure that we have that. In the interim, you can go to the YouTube page. Our DE.gov measles page is linked on its own. We update that every day, so there's always something new on there. And if you don't see anything new, it means our case count didn't change, and that's a good thing. And that's thanks to Dr. Buckner and the team. But we are happy to have you join us on our social media pages. You can comment in there, ask questions, whatever you need, but we really encourage you to do that and follow along throughout the year, not just during these outbreaks. Thank you.
Thank you, Kelly. So I'm going to just go back up to the slide that has our contact information on it for our Office of Infectious Disease Epidemiology. As Kelly mentioned, when you sign up, if you're not already signed up for our Hans, please do. But every time we send out a Han, it has our contact information in it, and the Hans that are on the website has much of the information that I walk through for measles. So that will be a fantastic resource for you. And now we can take questions. I'm going to go ahead and stop sharing if that's okay. Lynn,
Thank
is
you,
that okay?
Dr. Buckner. Yes, thank you, and Kelly, for an excellent presentation. We will now address questions in the chat box, or feel free to raise your hand. First question looks like from Carrie Karapides. Should we
Oops.
be offering the MMR vaccine to 6-month-olds at this time? And a similar question, Shalini asks, is there an accelerated vaccine schedule for MMR that is being recommended?
Yes. So I'm sorry, there were two questions in that. And I'm sorry, I just realized my camera still wasn't on. Please forgive me. I've done tons of these presentations. I should know better, but I appreciate this group's patience. So I heard the part about is the accelerated MMR? Yes, it is, because with the CDC recommendation is if there is an outbreak in an area that children 6 months and older should definitely receive they should go ahead and get started with the MMR. I do want to point out that because we did get a question today about whether children can have the MMRV, which includes the varicella vaccine. What I will tell you is that the MMRV is not recommended for children less than 4. So if you've got a child who's less than 4, they should have the regular MMR vaccine, and that's because doing so will lower the risk for fever-associated seizures, because we do see that happen from pretty regularly, and we don't want to increase the risk for fever associated seizures just because we're trying to kind of get the jump on measles.
Very good. Lynn asks, are measles generally more severe in adults than children, and are there differences in the types or rates of complications?
So I'll say it depends, right? What we are seeing so far with these cases is that it really just depends. And I think because most of us haven't seen measles during our training time, this is the time that we're learning. And what we're learning is we don't know exactly why some people are having more severe cases than others. What I can tell you, that one thing that I've noticed is that some people are having complications because they're not quite doing all of the supportive care that's needed. But I've also, and so we've been really, what I would encourage you to do is if you've got a patient who's got measles or suspected measles, really stay on top of them about supportive care, about the importance, I should say, of supportive care and hydration. It's essential. It can keep people out of the hospital. One thing that we're hearing from our colleagues in other states that have had outbreaks is that many of the folks who've been hospitalized have been hospitalized for that reason, because of dehydration and then other complications that come from it. We have seen folks who've been hospitalized with pneumonitis. There's not a whole lot that can be done to stop that, but that supportive care is still really essential. It's hard to predict who's going to progress to pneumonitis, but certainly people have underlying conditions. We know they're more at risk, but otherwise it's hard to predict. We have seen kids who've had mild cases, and that has been a surprise to me, but I've certainly heard about that from my colleagues.
Okay. Carrie Karapides asks, do you have a triage protocol for our nurses to use to help identify possible measles cases so we can determine if the patient should be seen in our office or virtually first to lower the risk of exposure?
That's a good question. I work on the epidemiology side. What I can do is we can take a note of that question and reach out to our colleagues on the DPH clinic side and see if they've got a protocol for their nurses. I'm just not quite sure about that. I'm sorry, but
That sounds like
we'll
a
certainly find out.
sounds
Yeah,
like
it's
a
a
good
good question.
idea for sure.
Yeah.
Yeah. Dr. Epps asks, where and when is immune serum globulin available? Last time we had a Hep A outbreak, for example, in Delaware, it took about a week to get it.
So, we found that depends. It's usually available through hospital emergency departments. That's where we coordinate with the hospitals. Usually we coordinate directly with the infection preventionists, but it's really a hospital's decision about if they carry immunoglobulin of any type. We don't carry it at DPH. It's not something that we are able to do. But we usually coordinate with the hospitals and coordinate so that we can tell you which hospital to go to. We usually do it based on what's closest and what's the person's preferred hospital, and that's the approach that we take.
Dr. Hoftoff says that the media was informed of the measles outbreak about 10 days before we got the Han. Can we please make sure the Han is sent out before the public is informed?
Dr. Buckner, can I take that one?
Yes, please.
Right, sure. Okay, so unfortunately, I don't believe that to be correct. On July 20th, we received our first test, and then it was confirmed positive late on January 20th. The Han was issued immediately after that with full distribution on July 21st. That is when our first press releases went out, and on July 23rd is when the measles outbreak was declared. So we did have Hans out prior to that talking about measles in the region and preparing everyone. And then when we had our first case, it was actually issued immediately. I would say maybe check your spam and promotions. There might be a setting on your box that delayed receipt of the Han, but I can confirm that it was sent out the 21st and we had it on the posted on the website when we went live with the measles outbreak declaration, which was on the 23rd.
Yeah, and to be more specific, we've been really watching about measles and then issued a Han about measles being detected in wastewater in the Lewis area. And so there was a Han that went out for that. I'm sorry, I've forgotten exactly when that was, but that was a couple months prior, I think. So unfortunately, we've been watching. I mean, I guess shouldn't say unfortunately, it's our jobs, right? But we've been watching for measles. And certainly the wastewater detection does provide evidence of how closely we are using a variety of tools to monitor it. I'll say that certainly with that detection, we were waiting to see if any of the providers would end up with a patient with suspected measles or reach out to us for a test, but that didn't happen. So all we can guess is that perhaps there was someone who had measles who was traveling through the area and shed it into the wastewater.
Very good. Lynn, do you see any further questions?
I do not, Dr. Kushner.
Does anyone have any other questions before we conclude?
If you do have a question, feel free to unmute yourself and fire away.
Okay, then having none, and hearing of the storm outside, I think it might be best to call it a night. I'm very grateful to our speakers. Thank you, Dr. Buckner and Kelly Callahan, for an excellent presentation. Very highly informative. I want everyone to get home safely. Thank you, and look for our next hot topic session to be determined in the future. Again, thank you both for joining us tonight for this really excellent presentation.
Thank you.
Good night,
Thank you to
everybody.
everyone who came out.
Thank you all.
Bye-bye.
All right, very good. Thanks, and be safe going home. Bye, everybody.
Good night.
You. Thank you.